Assalamu alaikum wa rahmatullahi wa barakatuh. Hello, Journal Club listeners. Today I'm bringing the challenge of diagnosing pulpitis, which we currently rely on the subjective assessments, such as the patient's symptoms, the sensitivity tests, which may not always correlate to the actual histological state of the pulp. That could lead to less precise clinical decisions, and the developing chairside application of the rapid molecular test that targets the level of some biomarkers of the pulp inflammation has been suggested as a potential tool for diagnosing the pulpal conditions. The use of these biomarkers is an active area of research that is yet to fully translate to clinical practice, and there are only two clinical studies that showed a strong correlation between some of the biomarkers, namely the MMP9 levels, linking them to the success of the vital pulp therapy treatment. In this prospective cross-sectional study conducted by Nawal along with Duncan and colleagues, which was published in April 2024 at the JOE, they aimed to quantify the levels of inflammatory biomarkers, specifically interleukin 8 and tumor necrosis alpha in patients diagnosed with reversible pulpitis, irreversible pulpitis, and normal pulps. And they investigated their diagnostic accuracy in differentiating between healthy and inflamed conditions. This study enrolled 72 patients aged between 14 and 53 years old with extremely deep carious lesions. They included 42 teeth and symptomatic irreversible pulpitis of 22 teeth in normal pulps, which was the control group, having sound, unrestored, non-carious vital pulp, which were indicated for orthodontic extraction or elective root canal treatment before the prosthodontic intervention. Pulpal blood samples were collected from all patients using a micropipette after pulpal exposure, and the samples were immediately transported using cool packs to the Department of Biochemistry and frozen until later laboratory processing. The level of interleukin 8 and tumor necrosis alpha cytokines was assessed in picograms per millimeters using enzyme-linked immunoabsorbent assays by one well-experienced blinded biochemist. For the results, the interleukin 8 showed significantly higher levels in the irreversible pulpitis group compared to the reversible pulpitis group, and the tumor necrosis alpha had also showed an elevated levels in the irreversible pulpitis cases compared to the reversible pulpitis. For the diagnostic accuracy, the interleukin 8 demonstrated a high diagnostic accuracy for differentiating between the reversible and irreversible pulpitis with an area under the receiver operating characteristic analysis curve of 0.99, which is almost perfect, indicating a 95.5% sensitivity and 99.7% specificity. On the other hand, the TNF alpha showed a lower accuracy with a 59% sensitivity, making it less reliable marker than the interleukin 8 cytokine. In conclusion, the application of the chairside inflammatory biomarker test was hoped to aid in the determination of the pulpal inflammatory status, which might change the whole perspective of the pulpal diagnosis in the future. And this study suggests that interleukin 8 is a reliable biomarker for distinguishing between reversible and irreversible pulpitis, helping clinicians make more accurate diagnoses beyond the traditional symptoms-based assessments. In my opinion, the use of biomarkers such as the interleukin 8 and TNF alpha could provide more objective biological measure of the inflammation and offer more reliable information into the pulpal status, and that there is a potential for these biomarkers to be used as a chairside diagnostic tools and could be integrated into rapid chairside objective assessment to evaluate the pulpal status and reduce the rate of having unnecessary invasive procedures, which will also aid in the treatment decision and have more effective vital pulp therapy treatments with improved patient outcome and minimize the risk of over-treatments. The only limitation of the study, in my opinion, is the time needed to process the samples and get to the results is considered impractical to be used at your side. However, if this could be improved and there's a way to have a quick objective assessment of the pulp using these biomarkers, we could definitely utilize this in our clinical diagnostics. Thank you so much for listening. Hope you have a wonderful day. Bye bye.